The following is brought to you by VerticalVet. Rethink your GPO.
Hello, everybody. Welcome to another edition of VerticalVet's Vet Med School. And today, we're taking you to school in the surgery suite. We're going to talk about an exciting new product that can help you in your clinical practice, because we all deal with these little oozing and bruising dogs, and sometimes we can help with that with a new product. And I'm super excited to introduce you also to one of our new corporate partners, and that is VETIGEL. They have some amazing products, and again, definitely check them out online. And again, we have special promotions and offers for VerticalVet members. So if you're watching this and you're a member, definitely contact us so we can get you in touch with those folks and you can learn more. But if you're not a VerticalVet member yet, ask yourself why, and just remember that this is the kind of information and education that we give our members on a regular basis. But today, I'm super excited to introduce you to Dr. Matthew Morgan. He's a board certified surgeon, and we're going to be talking about VETIGEL, which again is a revolutionary hemostatic gel that can stop bleeding in seconds. Guys, it is phenomenal. A little bit about our guest speaker today. Dr. Morgan graduated from Cornell University, where he received his Bachelor of Science degree in Animal Science, then went all the way down to St. George's University to get his DVM, and he did his clinical year back up at Cornell. He was the recipient of the Pfizer Excellence in Small Animal Surgery Award, as well as inducted into the Phi Zeta Veterinary Honor Society. I had a couple of those guys, but I was not one of them. Following graduation, Dr. Morgan completed a one-year small animal medicine and surgery internship and a one-year surgical specialty internship at Long Island Veterinary Specialists, a fantastic practice, guys. Dr. Morgan then went on to complete a one-year research fellowship at the Hospital for Special Surgery. I got to tell you, Matthew, I love your pedigree, but I also love the fact that you are bringing innovations to surgery for our members. Thank you so much for joining us.
Oh, thanks for having me. I appreciate it.
Well, listen, I think you're up at VERG in Brooklyn, but maybe tell the VerticalVet family a little bit about what you're doing right now.
Sure, yeah. I'm up at VERG in Brooklyn. I'm the chief of surgery here, so I've been here for about 5 years now. So it's a really exciting kind of time in my career where we started the surgery department here from scratch, and we've been building it. We now have a second surgeon. We have 2 full-time anesthesiologists. So we're really starting to crank out, a lot of good interns and surgery interns, and a lot of good technicians and specialty techs. So I'm excited about it.
Yeah, it's really a fantastic clinic up there, guys. If you're not familiar with VERG, I mean, definitely check them out online. They're doing some really cool stuff. In fact, Matthew, I believe in the background, you've got a magnet behind you. So maybe tell us a little bit about what
we've got our CT behind us here. So yeah, it's our 64-slice CT scanner. So it helps us, especially for things like MET checks. The old way of doing chest X-rays and abdominal ultrasound, the CT is just far superior when we're doing pre-surgical planning or MET checks. So I love having it.
Always a dream of mine. I always wanted a magnet in my practices, but these days it's gotten a lot better and more accessible, and more companies are making them. But I guess I want to start off today, talking about how did you get involved with this hemostatic agent? I mean, how did you learn about VETIGEL, and sort of like what's that story look like?
Well, I first heard about VETIGEL just because they're a Brooklyn company as well. So, they're founded in Brooklyn, they're manufactured in Brooklyn, really right down the road from me. So they got in touch with me in the early stages when we're, testing different syringes, different applicators. And, I first saw it, and I saw one of the research videos, which I'll show in a second, but it was really remarkable kind of how well it worked. And the fact that it's a flowable hemostatic agent is something different than I've been working with and typically what's out there in the market. So it has a lot of application just because it's flowable. It can get in tight areas where you have bleeds that previous things you really just weren't able to, or too cumbersome to get there.
Yeah, and I got to tell you, a good friend of ours is Jan Bellows, who's a veterinary dental specialist, and he just sings the praises of VETIGEL. And again, that flowable aspect, because I think a lot of us have had familiar, we've used other products that were powders, for example, or there used to be some foaming agents and so forth. And this is a whole different game. So again, I guess, when we're talking, why did you start using it? I mean, you're a surgeon. You're not supposed to have any bleeding going on. How did you get
Well,
it?
everyone needs some help with that. So, this doesn't take away from proper surgical technique. This doesn't take away from like meticulous hemostasis, but it's one of those things that I always have in the OR as a backup if we're dealing with a significant bleed, or even with just a standard liver lobectomy or a cholecystectomy where we have some bleeding just around the fossa that it's sitting in. This really helps with controlling that. I've used this from abdominal surgeries, thoracic surgeries. I've used this on neurosurgeries as well. Things that people see all the time, like enucleations or dental extractions, it works really well with. A drop pedicle for a spay. I've used that before. So it has a lot of applications for different things, not necessarily just emergencies, but I have used it for a lot of trauma cases. I've used it for gunshot wound stabbings, and I have a video of that later on. But it's one of those things where it has a lot of applications, and the more I've been using it, the more different things I've found that it works well with.
Yeah, and I'm glad you mentioned that because it does not in any way replace poor surgical techniques. Because, and I do get that, right? I mean, I get some young veterinarians saying, well, at least, I've got VETIGEL. And if it's like, no, this is kind of a backup. This is just an additive thing. It's to help you out when you need it, but it does not replace,
Right.
excellent surgical skills. So again,
Right. Still
I
have to
love it for
ligate the
them.
vessels. Still,
Right,
still
right.
want to do the same thing, but this is something where if you're getting some, bleeding from a site, and especially a site that's very hard to get to, or you might cause damage by putting a hemostat right on it. This is, something that gives you a little extra breathing room.
Yeah, especially those oozers. That's right. Well, now
Yeah.
one of the things too I want to talk about, is I mean, why should a veterinary clinic, a vertical vet member or a vet clinic out there that's watching this, why should they keep this on hand? I mean, what are the benefits to the clinic, to the vet, to the patient? I mean,
Yeah, well, I think the benefits kind of go across the realm. Well, one thing, we're going to decrease our OR time by getting these bleeders stopped faster. The VETIGEL itself comes in a sterilized syringe, so it's nothing that you have to mix beforehand or have prepared or heat up to a certain temperature. It's something that, as soon as your scrub nurse opens it, takes it, you take off the cap, you're ready to go with it. So it's something that's very, we call it a kind of a time-saving agent where it's going to be working in seconds. You're going to be able to finish the surgery faster, move on to your next case. And then you're also going to have less blood loss during surgery. So, less need for post-op, transfusions, which will save the owner's cost in the end and decrease hospitalization time. So it's kind of a cost saving around the board to the vets and to the owners.
yeah, and I love that. And again, I think for me, Matthew, with a lot of young veterinarians out there who are, encountering a large dog spay, or something that they're a little nervous about, I like having it on hand as that little extra insurance. It gives them a little extra confidence. You know what I'm saying? I mean, again, not to replace
Yeah.
surgical techniques, but I think it's really important to have agents like this on hand that gives that a little extra peace of mind to that maybe young veterinarian.
Yeah, absolutely. And in the OR, we have our crash cart with all our CPR drugs. We have the agents we're using very commonly, and then we have VETIGEL that's sitting there, so it's always accessible. If I need it, they can go grab it off the shelf. It's not put away, or it's not downstairs. It's not in a separate prep room. It's right there in the OR for me.
Yeah, I love that. And I love the fact that you said, hey, look, we have it on a cart just like all of our other equipment. Now, one of the things I think if veterinarians are not familiar with this product, I mean, talk to us a little about the speed, how it works kind of thing. I mean, and again, I mentioned briefly that, I think many of us have had experience, especially in the past with powders and foams, but this is very different. So maybe speak to like how this stuff works, how quickly it works, and why a gel or a flowable format actually makes more sense.
Sure. Yeah. Actually, with VETIGEL itself, there's a little bit of a learning curve on kind of how to place it and the right applications for it. So, with it, the vets have had a problem with getting a good seal to it or getting the bleeding stopped. They're usually just kind of missing one of the steps along the way. So, kind of the first thing that I'm looking at is when we have a bleeding vessel, you need to evacuate all the blood that's coming from the area. So either using suction around it, using gauze to get the pooling blood away from it, because with the VETIGEL, you want to apply it as close as possible to that vessel. So it's creating that fibrin seal, helping with primary hemostasis right over where the vessel is. If you're putting it just on top of a pool of blood, it's not going to have effect. It's not going to have an effect that's desired. So kind of evacuating the blood as much as possible, and then getting your applicator tip right onto that vessel, and then applying liberally onto that vessel so it mushrooms out around where the syringe is. And then once you're finished applying all the VETIGEL, then taking the top of the syringe and kind of smearing it off the edge. So it kind of cuts it off instead of pulling it back from the area. If you pull it back from the area, then you can remove that VETIGEL from the seal that's creating. It's more creating it like a tamponade around the vessel where that the small polymers are helping with the fibrin cross linkages, but just as a mass in that area, you want it to be able to stick all over it. And that the kind of the benefit of the flowable product is that in those tight spaces where you can't get either like the cellulose in there, or you can't get like a sheet in there or a powder in there, this applicator tip you can stick all the way into where that vessel is, and you try to get right on top of where it is. So, it's something that when you get it right there, it's going to be stopping the bleeding in seconds. And I think it would be a good time to show the initial video that I saw before I started using it. And this is a experimental video that was a pig jugular laceration, showing just the application process to it and how that works. So I'll start that right now. So that's the yank arrow suction, just removing all the blood from the area. And then here's the applicator tip going on, putting that VETIGEL liberally there, and then having it mushroom around the syringe. And as you can see there, stops the bleeding immediately. And this is about 5 minutes later. They wipe the VETIGEL away, just showing how strong of a clot that's forming.
Yeah, how large was that vessel? Do you have any idea, Matthew? I mean, it looked pretty big to me.
Yeah, it's a full-size pig. So that was, probably about 8-9 millimeters across.
Wow.
So it was a good sized vessel. So if it can work on something like that, then the smaller bleeds, I don't have a concern with.
Yeah, and it's remarkable because, again, we've just never had a product available in veterinary medicine like this. So it's phenomenal to watch this, and I've actually seen some folks using it in the past, it really. It is remarkably easy to use. The applicator tip is novel because you can really get it in there, as opposed to, with some of the old powders and foam stuff, you're kind of just hoping and guessing, but this is really amazing. Any other little technical tricks or advice you might have for a veterinarian who's...
They have a new tip that came out. It's basically, they call it a dental applicator tip, but we use it for smaller procedures. So I use it for neurosurgery. It has a small tip that goes to the end of it that allows it to get even into tighter places. So for things like dental extractions, it works really well. I use it for things like hemilaminectomies, where I'm trying to get to a tiny little bleeder, or I've used it on TICA procedures before. But that tiny little applicator tip, just gets you even closer to where that bleed is.
Wow, that is amazing. And that leads us to another good question, and that is like, where do you see us using? I mean, I know you've rolled off several, applications and potential uses, but give us some, use cases that you think a general practitioner is most likely to encounter.
Well, I'd say, things like enucleations and dental procedures are, by far going to be one of the more common things that you're seeing and needing bleeding control for them. So I think that's going to be, a great application for it. I also think just the kind of the run of the mill, toenail avulsions, it works great in lacerations. The kind of the typical, dog cut on a fence coming in with an open wound, that works really well. And it's something where you don't necessarily have to use in the OR. We use on the ER floor all the time for dogs coming in for bleeding. And one of the kind of, cases that sticks out in my mind as far as like a dog that was, definitely saved from it, was a dog that was stabbed that had an arterial bleed coming from the intercostal area. We're able to get the bleeding stopped even before we have the dog into the OR to do the repair of the chest.
Wow. I think one thing you said that I have not heard yet about VETIGEL usage, and I think a lot of Vertical Vet members are going to be interested. You said nail trims. Oh, wow. Can you expand on that, Matthew?
Sure. Yeah. I mean, it has a mechanism of action where as long as you're getting it right on the bleeding vessel, then it's going to help cause the platelets start to aggregate a little bit stronger. It helps with the primary and secondary hemostasis there. So I've used on those nail trims. The other thing that pops to mind is the epistaxis cases where you've tried the phenylephrine, you've tried the epinephrine up the nose. It's not working. We've used it before. We're putting the VETIGEL up the nose. Usually with the dog sedated at the same time, so they're not trying to sneeze it out, but using it instead of going to kind of our last ditch effort, which was the external carotid ligation. So, for that particular patient, saved us from having to do a surgery to ligate a vessel.
Wow, I love this. I mean, so many applications. And I'll tell you guys, our dear friend, Dr. Jambellis, who of course has been a guest here multiple times, and he's a personal friend of mine, just can't say enough good things about this. I mean, he says this should be in the arsenal of everybody who's performing dental extractions. And I guess you'd probably back that up as well. I know you're not a dentist, but
yeah, absolutely. I don't do as many extractions as Dr. Bellows. He's certainly the expert on that. But for like mandibulectomies, maxillectomies, used all the time. So I've started to use it instead of using the bone wax. I've been using the VETIGEL just along the layer, and it's something that you can leave in the body. It gets absorbed and broken down into smaller little polysaccharides that get absorbed by the body, so it's safe to leave in. I've left it in the abdomen, in the chest, and it's something that gets absorbed by the body. It's natural. It's made from algae, so it is biocompatible.
hey, highly speculative and probably inappropriate to ask this, but what about oral hematomas? I mean, I know a lot of veterinarians are frustrated, like, especially if they don't get it right the first time, it comes back 3 or 4 days later, still oozing and bruising. Any experience yet with oral hematomas?
Yeah, I've had that question before. I've never used it personally for it. I don't see why it wouldn't work for it, especially because it's able to be absorbed by the body. So I'd say that would be something, down the line to give that a try. But unfortunately, I don't have any personal experience with it yet.
Wow, I love it. Yeah, I got to tell you, wheels are spinning, and I'm sure a lot of folks.
Yeah, I mean, there's probably a lot more applications that we haven't even thought of yet.
Yeah, and honestly, I did have a colleague talk to me not long ago. They had a dog that came in that, and we've all seen these dogs. It was a dog they're boarding in their kennel, and it was like a golden type dog, and had shaken its head and had bleeding, that just wouldn't stop. I mean, I don't know if you've seen these, but
Yeah.
regular general practice. And he said, hey, it just stopped it. It was amazing. They did bandage and do other things to coapt it, but for sure. All right. So tell me about, again, some of the cases that you've used it on. I know that one of the cases you used it on actually made the news, and that I actually saw that on my Google alerts and watched it. So maybe walk us through some of those cases that you've said, wow, this is pretty impressive.
Yeah, absolutely. That one case, the dog's name is Benji. It was a little Yorkie. It escaped from the owner's house, and it came back with a big stab wound in its chest. So this is an image of the dog here. The lungs were visible when the dog was coming in. It had an arterial bleed. It was, spurting out at us, and we had to get the dog. First, we had to put a catheter in. We had to get the dog into the OR, and we had to get the chest repaired. But we're also dealing with this bleeding event that's going on, that if we do all those steps, unfortunately, the dog's going to bleed out before we even get into the OR. So it was something where I reached for the VETIGEL to start with, put the VETIGEL in, got the bleeding stopped, and then we had a second to breathe, to put the catheter in, to get the dog under anesthesia, to get into the OR, to fix the chest, and then to recreate that negative pressure in the chest. And that's an image, that second image there is after we put the VETIGEL in. That's the yellow that you can see there. And then the little circle there is just showing that, as soon as we looked at the wound, we're seeing the lung just coming right at us between the intercostal space. So it was, definitely something where I got our adrenaline pumping a little bit, and it ended up making the news. The dog did great, was able to be discharged about 12 hours later. And I have another video of the dog coming in, or here's an image from the OR, and then here's the dog coming in at the 2-week recheck.
Benji, how you feel, Benji? You feel better?
So back to normal after 2 weeks.
That's just impressive. And I'll tell you, two things really jump out at me in a case like this. And I think most of us, if you've been in practice for any length of time, you're going to see a trauma like this. The first thing, Matthew, A, you've got seconds, literally. And B, you can't visualize, you can't see what you're trying to do. And I think that those two things here, number one, it bought you a little bit of time, but more importantly, it bought you a visual field that you could work in. And that is remarkable, because I'm just thinking back in the day, it's just suction and sponging, and it's like, and maybe not, right? Because they're bleeding out very rapidly. What a phenomenal case. Anything else you got?
Yeah, well, actually, for abdominal cases, I do like using this in the liver. So for liver biopsies, previously we've used punch biopsies and gel foam to put into that area. VETIGEL works really well, and this actually saves me a lot of time with doing liver biopsies where I can just use the VETIGEL instead. I have a video that's showing a liver laceration. This is in a porcine model, and this is showing just kind of the effect of it and kind of how well it works with the liver, which is a very vascular organ. Bleeds a lot, and especially if you're dealing with any sort of liver trauma. It certainly bailed me out a bunch of times. So this is the experimental model. I wouldn't suggest stabbing the liver, but just kind of gives you an idea of what we're dealing with as far as the effect of it. So this is a incision. They're going to make about a 2 or 3 centimeter incision here. We're seeing the blood starting to come out, and then what we're doing is trying to get the blood away from the area as much as possible before the VETIGEL is inserted into the laceration site. And then the whole syringe is being applied. We're seeing that VETIGEL mushrooming out, and then we have a seal that's going over where that stab incision was.
Again, this is remarkable. This is just so cool. I got to ask you about the next door neighbor to the liver. Have you used it in the spleen?
I have used it in the spleen. Fortunately, we do have the ligature, which I can take the spleen out really rapidly. But if there's any sort of like splenic trauma, we can use it in the spleen and stop bleeding. And as long as the rest of the blood supply for the spleen isn't compromised, and we can leave the spleen alone.
Wow. And I'll tell you, I'm a big fan of liver biopsies and, used to see a lot of Yorkies and so forth. So I got very comfortable with it. But, there were always those cases that took a little bit too long to clot, and sometimes you even closed up and there was a little bit of blood, oozing. I think this revolution, this should give most surgeons, experienced surgeons, another level of comfort to do something, because I think a lot of our colleagues have a little bit of apprehension about taking a liver biopsy just for the bleeding aspect. Any thoughts on that?
Yeah, and I routinely, especially on like bigger liver lobectomies, where I'm just getting a little bit of oozing coming from the lobectomy site, where I don't want to keep putting sutures on it, or I don't want to keep using stapling devices and potentially causing more bleeding. With this, I'm either putting 1 or 2 syringes of VETIGEL just on the area, packing it off using a wet gauze so I can apply it right to the area and hold it against the area for a couple seconds. And that works really well on big liver lobectomy sites. So even small biopsies using this, just gives you a little bit more comfort. You can leave that in, not worry about, having foreign material within the body. This is something that the body is going to absorb, and usually within 2 weeks, everything is out. What I will say is that when I use a whole syringe of VETIGEL in the abdomen for like a liver lobectomy or a cholecystectomy, I do expect a little bit more in the way of fluid afterwards for the absorption. I've had criticalists that were tested that fluid before. It's not hemorrhagic fluid. It usually has a very low PCV to it. But one thing I just expect is a little bit more fluid as it gets absorbed.
Yeah, and that leads me to my final bit of discussion, and that's what are the contraindications? So we mentioned, obviously, there was a large vessel that you showed an experimental model on, but give us some of the indications and potential contraindications for using VETIGEL.
Sure. So I wouldn't use VETIGEL on an area that has an obvious infection. So, for example, if we're dealing with an abscess that has a bleed to it, that's one of the situations where I wouldn't use VETIGEL. Or if I'm putting a specific drain in there to treat an infection, I wouldn't necessarily use it. With the fluid that gets produced as it gets absorbed, with enucleations, I usually flush that out of the socket before closing. And then when I'm using it in neurosurgery, I usually leave that for about 5 to 7 minutes and then flush it out and then remove the VETIGEL. And then I'm usually using it so I can see the spinal cord. So once we get the bleeding stopped, then I have that removed. So for most applications, you can leave it. For some applications, I want to remove it because it does produce some fluid as it gets absorbed.
Okay, and then I guess the final thing is you mentioned a learning curve, and again, I've witnessed it. I haven't used it personally, but for the people that are watching this, I don't want them to feel like this is an overwhelming learning curve. I don't think it didn't appear that difficult to me, but maybe walk them through some basic steps to reassure them that this is something that any general practitioner can do and should be adding to their surgical suite.
Sure. Yeah, I have a slide pulled up right now as far as just application tips, and I'd say this is the biggest issue that we have with people using it and not feeling comfortable with it or not having success with it is just the application process for it. So, the first thing that we do, take the cap off, prime it. So push the plunger down until the VETIGEL comes out to the end of the applicator. Then you want to hold it perpendicular to the area where you're applying it. So once you're getting that plunger as close as possible to that bleeding site, you're going to push the entire syringe content. So, and this is something where, less is not more. We say more is more for this. You want to use, pretty much the whole product for it. So it's mushrooming out. And then once you're finished with applying it, then shearing that tip off so it doesn't pull the VETIGEL out with it.
Yeah, I mean, guys, this is something I think that we should all be embracing, and that's why we're so excited to bring this to the VerticalVet membership and to all of our colleagues, because we think that this is really going to revolutionize a lot of your apprehensions and those little small bleeders that you just can't seem to find that can really add time. And I love the fact, Matthew, that you did mention the time-saving element of this, because I think that oftentimes in my 32 years of practicing veterinary medicine, you wind up spending a lot of time chasing down an oozer and a bruiser when something like this could have solved it in seconds. I mean, it's remarkable.
Yeah. And this is something that, myself being in the Army Reserve, kind of the second part of my job is looking at hemostasis in more of the battlefield and the traumatic wounds and tactical casualty care. So, this is something that, in Brooklyn, fortunately, we do see, a fair amount of gunshot wounds. So, this is something I've used in gunshot wound patients, in stabbing patients, patients hit by a car that are bleeding. I have one slide pulled up right now that just shows the latest patient that we had with a gunshot wound, and the plunger sticks really well inside gunshot wounds. It's something that really helps with bleeding, and kind of, my next goal is to be able to get this to all, canine handlers, to, police forces that do employ canines, and just have this in their back pocket so they can, put this in their canine first aid kit, be able to, treat, dogs that are out in the field before they even get into the veterinary hospital. And this is going to, help them, help us, and overall be a huge win for canine tactical medicine.
I love this, and I am with you 100%. Of these canine, teams should probably have this in the car, or in the van when they're out there on patrol, and especially in high-risk situations. Is there anything that, let's say, again, just hypothetically, if they deployed this in the field, would it in any way hinder or impede surgery or further treatments? You know what I'm saying? It's like,
this wouldn't. This is something where, with just, if you needed to see the area where the VETIGEL was applied, just using sterile saline, flushing it out, you're going to get that field back again. So it's, nothing like a powder that's going to be sticky that you can't operate in the field. This is something where if you need to see, what you're dealing with, you can flush it out, that's fine. Usually after a couple of minutes, the VETIGEL is doing its purpose and creating that clot. So you can flush it out. So, using it in the field and then bringing the patient into a hospital is going to have no negative effects. It's only going to be positive effects, getting the bleeding stopped and having less blood loss for the patient.
Wow. I mean, this almost seems magical, which is great. That's a fantastic description of a product like this. Any last bits of advice before we let you go today? I know you've got a busy surgery schedule ahead. Anything that, you want to make sure that the VerticalVet members and our colleagues, veterinarians, veterinary technicians that are watching this sort of know about VETIGEL and maybe why they should use it?
Well, I'd say, reach out to VETIGEL and just, give it a try on something where, it's not a high risk situation where you have a chance to, prep the syringe where, in even some of the demonstrations I do with referring vets, we have them do it just on a model so that they can get a hang of, applying it, because it does have a little bit of a learning curve. You don't want to be doing it your first time on, a patient that's bleeding out. So I, recommend just giving it a try first, how it handles, kind of the mechanisms, that you can use it for. But it's something once you get comfortable with using it, I foresee everyone's going to be really, pleased with the product and, going to be demanding it in their OR is, something that, is, just as essential as your crash drugs that you have there too.
Yeah, and again, guys, I know we haven't mentioned, how it works and what it is, and I definitely want to refer you to the VETIGEL.com website to learn more details. But I mean, this is a plant-based product. I mean, this isn't like some, exotic chemicals that are kind of being created. I mean, this is really fantastic science.
It is, and the best part for me, is just that it comes sterile. You don't have to sterilize it. You don't have to mix it. You don't have to warm it up. You don't have to really do anything to it other than unscrew the cap and then apply it. So it's something where we don't have to keep it in the fridge. We can keep it right there in the OR and as close as possible to the scenarios where we would need it, and that just makes it that much more valuable.
Yeah, this is invaluable in my opinion. I want to thank Dr. Matthew Morgan and VETIGEL for bringing you this exciting information. Hopefully it's given you a little bit of insight into a new tool you can deploy in your surgery. I think it's going to save lives. More importantly, it's going to save time and make you more confident in the surgery. So again, Dr. Morgan, thank you. Fantastic.
Thank you for having me.
Well, guys, that is it for another exciting edition of VerticalVet's Vet Med School. And guys, for us, we want to bring you innovations like this because this is going to help you thrive in practice. We want to elevate your clinic. We want to make sure that you as a practicing veterinarian or veterinary technician have the tools, information, and resources you need to succeed. And VETIGEL is one of those success tools, in my opinion. This is so exciting, guys. Definitely, we want to find out some of our special sponsorship, partnership with VETIGEL. Reach out to us at VerticalVet. You can call us, you can email us, you can check out our website. We definitely want to know if you're not a member of VerticalVet yet, why not? We have some amazing programs, including my favorite, which is our peer group, which we share information and heartaches and advice with each other. And I think that is really invaluable in today's age. Again, I want to thank Dr. Matthew Morgan, special surgical specialist at VERG in Brooklyn, and of course, VETIGEL, because they're making amazing stuff. Guys, we will talk to you next time.